Are you considering having an aesthetic procedure performed? Confused by all the information out there? Welcome to It's a Young Thing, where Nurse Paula Young arms you with the knowledge on all things cosmetic and aesthetic. And now, Nurse Paula Young.
Hey everyone, it's Nurse Paula Young from It's a Young Thing. Thanks for joining me today. Today we're going to talk about a topic that is not very comfortable for most women to admit, but it's called cellulite. And pretty much everybody has seen cellulite, has cellulite, or knows someone who has cellulite. And there's a lot of misconceptions about it. And mainly, believe it or not, this is a problem mainly that women experience. Not so much men. You know, they kind of get off easy with cellulite issues. It's really a woman's problem, and it's not a fat problem. People think, I don't have any fat. How do I have cellulite? Because cellulite is a structural problem, like under the skin, not where the fat lies, but kind of even deeper than that. And what it is it's caused by these fibrous bands underneath your skin. And think of them almost like rubber bands, and they pull the skin down and it causes this dimple. So the pockets of fat kind of push up underneath there. So, there's a lot of these remedies. You see these creams and things for creams aren't going to work. It's not a fat problem. It's a structural problem. You can lose weight. You can lose a lot of weight. You can work out. And you know what? You could still have cellulite, especially like on the backs of the thighs and the buttocks. That's like the biggest areas for cellulite. So creams and potions and lotions, I've never seen one today that worked. The only thing that might actually work about that is the mechanical massage of your hand, like rubbing and like breaking down the fat particles that are underneath. And that's a temporary solution. So I'm going to talk to you a little bit about how you can effectively treat cellulite if you've got it. And if you go to any provider, they're going to grade you on a scale of severity of cellulite. It's from really mild to really severe. And that pretty much will determine what type of treatment would be best for you. You never want to go for the big guns if you don't have a severe case of cellulite. Well, I'm talking about big, deep dimples that are pulling in on your skin. So let's talk about some of the milder ways. There's devices on the market like what we use in our medical spa at Young Medical Spa. We use VeloShape, and VeloShape incorporates a couple of different technologies. It incorporates radio frequency, infrared, mechanical massage, and suction. And what this does is it actually works the fat cells that are underneath your skin, and it causes the fat cells to leak out their contents. They're still alive. They're under there. They're still alive, but they've kind of emptied out. And with all those four modalities that I just mentioned that VeloShape has, it kind of helps your body work all that fat that was released out of the cells into your lymphatic system. And then by walking, exercising about 20 minutes a day, staying hydrated, maybe taking a multivitamin if your doctor permits it with niacin in it, which is a flushing vitamin, you can help get that fat out of those cellular spaces through the lymphatic system, and then you kind of get rid of it. But you got to realize the fat cells are still alive, and you're still not correcting the structural problem. So it's something you've got to keep up with maintenance. Now, if you really want to fix it structurally, there's nothing you can do other than going underneath the skin and snapping those fibrous bands to release the skin. And there are two devices right now that I know of that do that pretty well. The one that we use is Cellulite, which is a laser that goes underneath the skin through a puncture hole. You're numbed up ahead of time with tumescent local anesthesia under the skin. And the laser fiber goes through and it snaps the bands sideways and it releases them. And guess what? The skin just like pops back up again, and the dimples pretty much just disappear, which is great. And then it also has a top firing laser that the provider can set off. And what that does is it kind of smooths and tightens the skin up and really gives you a nice result. Another device that has been released is called Selfina. Pretty much does the same thing underneath the skin, but instead of using a laser fiber, it's kind of like a tiny sharp instrument that severs those fibrous bands. Now, with these two types of therapies, one treatment is usually all you need, but you got to realize you're going to have some downtime. You're going to be black and blue. You're going to have some puncture holes. They're very small that the tumescent anesthesia, that local anesthesia will kind of leak out of. You got to prepare for a little bit of cosmetic downtime. I mean, you're still going to be able to walk around. You're not going to be, laid up in bed a couple of days by no means. I mean, it's really not that painful. It just doesn't look that great with a bunch of bruising, a lot of bruising. And a bunch of magic marker lines that are going to be drawn on your skin for the zones. But that is a surefire way to really get rid of pretty severe cellulite that's underneath the skin. So, you got to remember, it is a structural problem. Dieting is not going to solve this. So if you're really considering this, you really want to seek out a clinic that offers a variety of therapies that you can treat your cellulite with, because you don't know if you've got moderate or mild or severe. Go in, get scaled, get judged, get looked at, get some photographs, and then see what they have to offer. My best advice is to start out small. Don't always go for the big guns. Start out small, see if you get some relief with some of the more non-invasive therapies, because you always have something that you can work up to. So that's it for today. I'm Nurse Paula Young, and you've been listening to It's a Young Thing. Make sure that you listen to or subscribe to my podcast on iTunes, and it's also available on SoundCloud. And you can also visit our website at youngmedicalspa.com. I have a podcast page there that you can listen to all the episodes. Make sure you subscribe. You don't want to miss any episodes that are coming up in the future. We could be talking about a procedure that you've been thinking about for a long time, but have been afraid to ask. Thanks so much. We'll talk to you next time.
You've been listening to It's a Young Thing with Nurse Paula Young. If we didn't discuss a topic you're interested in today, be sure to subscribe to our podcast on iTunes, so when we do, you don't miss it. The cosmetic aesthetic world can be confusing. We're here to arm you with quality, truthful information from our many years of experience. For even more info, youngmedicalspa.com.
This has been a Steve Mittinen social media creation. Steve Mittinen, socialmedia.com.
The creators, producers, participants, and distributors of this podcast disclaim any liability in connection with the material expressed herein. This information should not be substituted for individual medical counseling. Information on this podcast is not intended to diagnose or prescribe treatment for any condition. It is intended for educational purposes only, based on the research and experience of Young Medical Spa. Discussion of specific treatments is done only in an office visit directly with the patient. Contact our office to schedule.